Welcome, everybody. Hello. We're here for another Holistic Vet Sisters at 6 o'clock UK time. And we are here from a few countries today. So Dr. Vicky, Simon and I are here in the UK. And Tina, I think, is in Norway at the moment. She often heads in from various countries. She's going to tell us all about a conference she's been in Hungary this week as well, which sounded really interesting. And Dr. Lise Hansen's with us as well from Denmark. So we're here to answer questions as we are every week. If we don't get to your question this week, our aim is to get to it next week. So do head back next week. We do try to answer all questions that we get asked. So post them in the comments today. And yeah, let's see. Ladies, what do we want to talk about first?
I had a question that I was asking Vicky just before we went live, because I hear a lot of there's a it's a herb, presumably. It is a herb, isn't it? Agnus castus, which is a is sort of being sold. I come across it more than I have before, now that we're not neutering anymore and everyone's trying to look for other ways to manage hormones. And it's being sold in all sorts of different preparations to manage, it seems to me, anything hormonal. And because Vicky's a herbalist, I was just asking her about it and how useful is it? And what can we trust? And what's just people trying to sell a product, really, is what I'm trying to ask, but putting it nicer.
Yeah, so I mean, there is lots of beneficial uses from Agnus castus. I have it in my practice. I use it quite a lot. The thing I actually probably use it most for is equine Cushing syndrome. And equine Cushing syndrome is different to canine Cushing syndrome, because canine Cushing syndrome is hyperadrenocorticism, whereas equine Cushing syndrome is pars pituitary intermedia dysfunction. So it's actually like a different part of the brain, but for some reason they're both called Cushing's. And Agnus castus is really useful in equine Cushing's. I've had some really good responses in those kind of cases, getting blood values down and things like that. So amazing for that. But in terms of like sexual hormones, most of the kind of studies and research and data and stuff that's available is to do with female hormones. And there's some really good results that you can see for normalizing. Some of it's in people, so just like normalizing abnormal periods or seasons, helping bring animals or people into season that aren't, or people having periods that aren't having their periods. But most of the stuff is female hormonal. And I know, Lisa, you asked if I'd come across a product that was for male dogs. And
yeah, there's a Swedish dog behaviorist who's marketing a product that he calls Testo Block, which is Agnus castus, which is suggested. I mean, the suggestion is that you give it to virile male dogs and it'll calm them down, which I was a little bit, I don't know. Have you heard it used in that context?
No, but the traditional usage, so Agnus castus has many names. So it's like full name is Vitex Agnus castus, but sometimes it's called chasteberry or monk's pepper. And the reason that it's called that is because it's sort of historically monks used to take Agnus castus to try and suppress their sexual urges. And that's right. And again, like chasteberry, like being chaste, trying to reduce your sexuality. But as far as I'm aware, from what I can recall of herbal books that I've read, I've not come across any actual solid evidence that it does that for males. It's possible that it might do to a low degree, but it's not something that I would ever prescribe for that reason. I'm not sure there's enough evidence available for that. But for female hormonal problems, it can make loads of difference. There's other herbs you can use to help with those kind of things as well. And I mean, as you all know, Lise, homeopathy can be great for helping with abnormal seasons and seasonal behavioral issues and things like that. So yeah, it can be great for hormonal things, but you know, it's not a cure-all for everything hormonal, as I think they're probably trying to sell in a lot of these products.
They missed out on a sales slogan, though. You know, turn your male dog into a monk. It's interesting. I think it's also interesting that, I mean, I absolutely take your point about using herbs or homeopathy if there are hormonal irregularities or hormonal imbalances. But sometimes when we talk about dogs, it's completely normal. You know, there are no hormonal imbalances. A female dog with a mild or moderate false pregnancy, or a male dog who's just feeling sexy, neither of those are necessarily suffer from any kind of hormonal imbalance, that they're just expressing their normal, which is why it's an interesting discussion, I think, about how appropriate it even is to try and treat it, because there's nothing necessarily wrong with them in some of those situations.
Yeah, absolutely. And I think, you know, lots of people, particularly in like the teenage dog phase with male dogs, where like suddenly they hit sexuality, and like teenage boys, they just want to like hump everything and like just be completely ridiculous about it. And I've had owners come to me about things like that. And, you know, sometimes they end up having an implant just to get them through that kind of bad puberty stage, and then when they come out the other side, often a lot of that kind of intense behaviors have calmed down. But I've also had some success using like low potency testosterone or things like that in place of that, just to slightly tone down some of those excessive behaviors. But I agree, you know, it's not necessary. But I often say to owners that, you know, we always talk about animals' quality of life, particularly in like end of life care, but I think you also have to take into account owners' quality of life. So if you've got a behavior or something that's really compromising your quality of life, which, you know, in difficult behavior cases, I'm not saying these are difficult behavior cases, but it can really impact you. And for some people, it can be really difficult, especially like older clients that are struggling with a strong young dog. It's already pulled them over and broken their arm, or both their arms, as I had one happen to one
Oh
client.
my God.
And, you know, they need something to help them manage this dog. And so in those kind of cases, it's almost become pathological for the owner, but even if it isn't for the dog. So that's where I think using your natural medicines is a much better way of trying to manage these kind of behavioral issues than it would be to actually do something on a more kind of medical basis.
Absolutely. And I think another example of that is an intact female cat, which can be difficult to have as pets, can't they? It's their natural behavior, but it can drive everybody crazy. I was going to ask Tina about that, because you've got an intact entire cat, don't you?
Yeah, I do.
How strong are her seasons? Because I'm normally telling people, you know, you can, but you probably won't want to, because it's going to drive everybody mad. But
It depends. My mom absolutely hates it. I think she's kind of cute. So yeah, it depends what you know. I think, you know, because she's very much like a ladylike, and she's like, ah, no, I don't want to cuddle that much. But then when she's in season, she's super cuddly, and sometimes I feel like she almost comes out the other end more cuddly, or like more, I don't know, like she feels more comfy after being like that, because they initially they seem high when they are in season. They are literally high on hormones. So yeah, I think sometimes she comes out on the other end even more cuddly than she was before she went into the season. So, but yeah, I know a lot of people think it's super annoying, and sometimes they can be a bit loud, but I mean it's normal.
sure, I mean, that's the whole point. It's normal. But I mean, if it's not keeping your mum up all night, and that's why she doesn't like it, or
Maybe. Maybe.
sometimes what's normal for them can be not practical for us. I think that's a good
Yeah,
point.
I think the
Yeah.
spraying that you sometimes get with males is not very convenient when you live or it's inside a lot. So
Oh no, yeah, male cats, yeah, definitely. Can I ask Vicky another question? Actually, oh, it's good. It's so nice to have you here. I'm full of questions for you, because you were mentioning Cushing's disease, and I had this discussion with someone today, and we've had a question about it as well. Cushing's disease in dogs.
Yeah.
What's your take on that? I mean, it's one of the few diseases where I'm not very comfortable with the conventional treatments, if I'm being completely honest. I find that they're often not tolerated well, and they're often not that effective. What would you say if someone comes to you with a newly diagnosed with a dog that's been newly diagnosed with Cushing's disease and is symptomatic with Cushing's disease?
I mean, it does depend a little bit on severity, because you know what they're like. Some of them are extremely mild in terms of symptoms, and some of them are quite severe in terms of symptoms. And I think sometimes they can go undiagnosed for ages before anyone gets around to actually diagnosing the problem. Um, so it does depend a bit on how they come to me. But I do have quite a few cases that I manage without any conventional medicine. Sometimes that's because they've tried it and it hasn't worked. Other times it's because they're very mild cases, or the owner just absolutely is not going to give them any conventional medicine. So it's either I treat them or they have nothing. And like you, I've seen lots of side effects and poor responses from the conventional treatment. I don't think it's at all a guaranteed result like some medications that you get from feeders. I think it can be hugely variable. And yeah, I'm quite happy to treat those cases. I usually do a combination of herbs and homeopathy. And I think with anything hormonal, you always get slightly mixed results because hormones are just so variable and so many external influences can impact them as well. But yeah, for the most part, I definitely get positive responses, whether it's like a complete resolution of all symptoms or just improvement in those symptoms. That is slightly variable. But yeah, I'm generally quite happy to treat those cases. I think you can get nice responses, particularly with the herbs. And I always use like Mark Elliott's old classic homeopathic combination remedy for Cushing's.
And then they're often very elderly dogs as well, which can complicate the picture, can't it? And then if they go on, what is it, Veteril,
Veteril,
typically
yeah.
for I don't know. I've often seen I'm a little bit uncomfortable with some of these very, very old dogs that get this diagnosis and then go immediately onto the drugs, and I've seen quite a few of them not do well with that. So they're often got other conditions, and you need to manage those very elderly patients carefully. But
yeah, absolutely. And I think that's also where holistic medicine is great, because you can do things that help all of their different conditions. It's not just like, right, this drug for this condition, this one for this one, this, because then it becomes like a ridiculous pharmacy of drugs just for one little dog. Whereas, with your homeopathy and your herbs, both of those are selected based on the entire picture. So you're making up your herb mix or whatever based on all of the things happening with the dog, and you're choosing your remedy based on all of the stuff that's going on with the dog. So you're going to be doing something to help everything. You're not just going, right, let's do this for the Cushing's and do it all exactly like that. And I think that's a much better way of managing any kind of geriatrics. And Cushing's in a lot of cases, unless, again, sometimes it can be really bothersome for the owners, and some of them are really bad with their drinking excessively, eating excessively, peeing excessively, especially if they're a bit incontinent as well. That can be difficult to manage. And I have seen dogs do well on Veteril as well. So, I think you just have to look at each case individually and look at the pros and cons of all the options and see what happens.
Absolutely.
Tina, what do you do with them with traditional Chinese medicine? Is there specific things that fit a Cushing's picture, or is it?
Yeah, again, with Chinese medicine, it's not like you come in with a diagnosis and we're treating that, You look at the tongue, you look at the pulses and how the animal's behaving and all these things, and then you put together a Chinese diagnosis and you treat that. So that's the funny thing with Chinese medicine is you can have 10 dogs with diarrhea and they can all have a slightly different diagnosis and get treated in slightly different ways. So I think, yeah, that's an interesting thing with acupuncture as well. I haven't actually treated Cushing's personally, but I think from my studies they said it worked well in endocrine cases as well.
I think that's the case with all this holistic medicine, though, because even with diet, we would look at the dog rather than the ailment, really. And I think Vicky's saying that's what she does the same with the herbs. That's the beauty of it, isn't it?
And I think that's exactly what ties it all together, even if you're using different modalities, is that you're looking at the whole patient. Absolutely.
And I think a lot of people don't always understand that, because I'm sure you guys get this too, where you get an email from someone like, have you got anything to treat skin disease? What can I give my pet with Cushing's disease? And there's not, I haven't got like a book that I just, Cushing's, yep, 1, 2, 3, that's what I do. Like,
that's the Western way of treating.
Yeah, that's such a common question, isn't it? Is there a good homeopathic remedy for? And I always am tempted to say, well, no, there isn't a good homeopathic remedy for anything. But there's often a good remedy for the patient that needs it, so that the symptoms go away. But it is a completely different way of thinking about disease and approaching disease, isn't it?
Yeah,
sure. And That's one thing that like bothers me that people don't know as well, is even if I do Western or Eastern medicine, it's like, hi, my dog has this, and then it's like the differential list. Even like when I do Western medicine, the differential list is long, and I can't guess without doing testing, so I need to come in and see it. And even with like homeopathic things, they say, oh, my dog is this, and really like I can suggest general things that might not work, or we can have a proper consult. I can go through everything, and then we can make a plan. But I think that's what people don't get, because in the Western world is very much like, I have this diagnosis, what can I use? And people can't really wrap their head around that it's not exactly how it works. So yeah.
And how changeable they can be. I mean, I've experienced homeopathy myself, and you might begin with one remedy and then you actually need to move on to another one. So unless you sort of keep in touch with your vet, you might be sticking with something that actually has progressed and needs the next layer unpeeling.
Yep.
Yeah, I think especially with complex cases, they're like layers of the onion, you peel away one outer layer and then you've revealed the thing that's going on underneath, and you need something totally different for that, and then that peels away and it just keeps going.
The constant education.
Yeah, I feel like that's the most frustrating part, maybe, is the ones where you only get to see them for a couple of times, and you barely even have time to get to like the surface to touch something before they maybe don't show up. And that's very frustrating, because usually with holistic medicine things take time sometimes, and then sometimes you can remove some things and then some other things become more clear once you treat something, and then you can get Herxheimer reactions, and you really need to like stick to it and kind of give it time and some patience. Healing takes time. It's not a quick fix.
Does this go lead us into the question that we had from Alicia? Because that's quite a complex, there's lots going on in that.
Yeah, sure. So yeah, Alicia had a couple questions as well. So one of her questions was that her dog has tree pollen sensitivity, and it keeps rolling in fox poo, covering the exact same areas of her body every time. So her left ear and by her groin area, and she has seen the vet who has ruled out any infections, is unsure to why she keeps covering the same exact areas in fox poo, and she's wondering if it can be some kind of zoo pharmacognosy. And so, yeah, she's trying to fix the underlying cause and restore her microbiome. Yeah, for a short-term management strategy, can you recommend anything topical someone in the situation can apply to help soothe the itch on her red inflamed areas?
Lise wanted to answer this, but can I just say this would be poo pharmacognosy? Oh, go on. I'll Lise answer.
Oh, classic.
When we do a best of 2025 Holistic Vet Sisters clips, this will be the one.
My screen's gone grey again, so I can't see you guys. So if I interrupt,
we are applauding you. Touche.
Anyway, go on.
Caroline Ingraham should hear about poo, whatever it is we're calling it now.
This dog particularly has chosen this particular fox poo for a reason. It probably isn't self-selection in the slightest, but
my answer would just be that when you mention a tree pollen sensitivity and red inflamed areas, that if I'm hearing that correctly, there is a dog with an allergic skin disease. And as a homeopath, my advice would be that you need to see a homeopath and get some deeper acting treatment. I don't think it will ever be a question of finding something topically. If there's inflamed skin and there's an itch because of an allergy, then that means that you have an overacting immune system, and it means that you need something that goes deep enough to balance the immune system. And I only really know homeopathy, maybe acupuncture, that can do that. So I would think deeper than merely looking for something topical to soothe the skin. I would find some professional deep acting treatment that can rebalance the immune system and sort the root of the problem. That would be my comment.
I would say as well, because I think Alicia's asked us a few times with different layers of this. It's going back to this layers thing. And I feel that often, if there's a lot of different things happening with the dog, it can get really confusing for the guardian as to what's actually linked and kind of what is the chronic symptom that's happening that's allowing for these other acute things to occur. And it may be that the self-selection of the phosphor has got nothing to do with anything else. It might just be the behavior. That's the behavior that the dog is doing at the time. And dogs often, just to talk about that for a second, dogs often are quite habitual physically. Their proprioception can become really habitual, which isn't necessarily a great thing because you want them to have good balanced proprioception across their whole body. But they can be really habitual in terms of how they sit, how they lie, and how they roll over. So it may be that this particular area is just the dog's habitual way of lying, moving, rolling on the grass. It may be nothing more than that, but it is part of a jigsaw puzzle that would make up the whole dog. So I would say that, Alicia, rather than getting all these different products and aiming to sort of help in that way, and it's great that you want to look at all the natural things, that's a big tick, but don't spend any more money on stuff until you've seen somebody. Now, I mean, not that I'm saying you must go to Dr. Leese, but for instance, Dr. Leese does offer online consults, and lots of people can help you online if you can't find somebody in your town or your nearest city that can help you. Holistic vet wise, I mean. So yeah, I wouldn't just sort of be doing all this stuff and getting yourself all confused. I'd work with somebody so you can make kind of a plan, really.
But that said, you know, sometimes you do want something topically to help relieve inflammation. You know, even in chronic cases, while you're working on that, sometimes you do need something that you're going to apply topically just to help the animals along. Or if it is a one-off thing, like your dog has rubbed against something that has created that in like a different scenario. And there are loads of different topical things that you can do to help soothe. And one of my favorites in that scenario, especially if it's itchy, is just chamomile tea. Because you don't have to waste loads of money buying something silly. You can just get something really simple. It's mild antiseptic, it's mild anti-inflammatory, it's got some anti-itch properties. So it's just a really nice, gentle, soothing thing that while you're trying to track down someone to really help you get to the bottom of your pet's problem, you can just do something that might just relieve it. And if it's really hot, then sometimes something like aloe vera that's really cooling, that can be really nice too. Or, you know, calendula balms for helping to heal like grazes or abrasions, stuff like that can be really nice too.
And the ingenious probiotics products. I missed the opportunity to get Joe's product in there. Yeah, they're great as well. The skin sprays. So I mean, but I guess what we're saying is get these, but then find some other support as well.
Yeah, absolutely.
And can I just throw in there that I had this conversation with someone today who I think was a bit miffed because she wanted holistic treatment, and my suggestion was absolutely that she get a steroid spray, because you know there's a dog with severely itchy, inflamed paws and ears, and I think that this dog is not comfortable. And yes, we're going to address this and we're going to start treatment and we're going to get to the root of the problem, but right here right now this dog needs some steroids to be comfortable. So I think topical treatment absolutely has a place. It will, by the nature of it, always be short-term relief, but short-term relief also has a place sometimes, while we look for a, you know, spend the time and the energy looking for a lasting cure. And so I just wanted to throw steroids in there because I think sometimes they do have a place, and sometimes people kind of go, oh, but how could you possibly suggest that steroids are evil? That's not why we come to you. But I think the most important thing is that the patient is comfortable throughout. And the only problem with these short-term treatments is if that's all we do, because then we'll be doing them forever. But to tie us over, they're absolutely fine.
And I think, you know, a lot of people come to a holistic vet and they expect you to be really anti all pharma, and that's not the case. You know, we're vets. We know everything about the drugs and how they help, and we know when they're appropriate. And, you know, sometimes your pet will come to us and we'll be like, actually, your dog's got like a, you know, deep skin infection in its feet or something, and it can't walk, it's not comfortable. You need, you know, potentially an extended course of antibiotics to clear that. And whilst that is happening, we will do all of our other stuff to help the immune system and rebalance everything. But you actually need some conventional treatment. And you kind of get a mixed response. Some people are quite shocked, but other people are more likely to take that advice from you than they would take from their regular vet. And if their regular vet says antibiotics, they go, oh no, absolutely not. But they're more likely to accept it when it's something that you've recommended.
Yeah, and I think it's a point that we can't repeat often enough, really. It's not about something's good and something else is bad. It's about understanding the different tools and applying them appropriately, and combining them when that's in the patient's interest.
Yeah.
I absolutely agree with everything that's been said here. I think it's important that people understand that because a lot of people tend to get a lot of advice online, and we do give very good advice. But it's also, you know, if your pet is struggling with something, you know, you can throw all the supplements on there, but a lot of supplements and even herbs, they're there to kind of relieve the symptoms, a bit like medication are sometimes if you don't get to the actual root. So I think it's very important, you know, instead of looking here, looking there, and reading everywhere and trying every single herb in the book, I think just spending those money on an online consult with any of us or with another integrative vet and actually like getting to the root of it and taking step by step, and then you can use the appropriate herbs to kind of soothe where it's needed. Because I see this very often that people, you know, they want everything holistic, and then even they come to me and they say, what can I use for this? And maybe, okay, because they didn't want a consult, I just throw some supplements at them and oh, okay, they're feeling better. But I know deep down that this is not going to be a long-term solution. So then it's like, did it really, you know, that's the long-term solution. I think it's more to focus on than just, obviously sometimes, like Lisa said, we need to, what do you write in your book? Put down the fire.
Yeah, firefighting, yeah. And
Firefighting.
that's what a lot of these short-term topical treatments are. And sometimes that's what's needed. Absolutely. But there's also sometimes this idea that's a bit like we were talking about the Agnus Castus before, but even more in more general terms, that if something is good, then you know everybody should have it, and if something else is good, then they should have that as well. And then you have perfectly healthy dogs on 15 different supplements, and I'm thinking, but why? Because it's good. And I think that however we're going to treat a targeted approach, a plan, is always a good idea.
Absolutely. Do we have any more questions in the chat?
Someone asked, can you put the last cream in the chat, please? I don't know, the last cream, did we see it was a steroid cream or was it the
I think that was
calendula?
steroids. Let's not do that.
Yeah,
this will be I don't know why I'm doing the 2025 summary now, but it'll be me saying do steroids.
I think we should definitely make one though. It'll be funny.
Yeah, that's your job. No, there was a question from Dawn Richards.
Yeah, this one's about because you mentioned last time about vaccinosis. Could you please let me know what you mean by this? And then the second question is the idea of escalating pain management is ideal and is typically what we do in humans, but I wonder how easy it is to detect incremental increase in pain in dogs. We have also to be mindful that repeat appointments for physio alongside other alternative methods can be very costly for many owners. I'm guessing this might be a barrier for vets suggesting it in many cases as well. But yeah, start with the vaccinosis.
Oh, this was the comment because we were discussing Librela with Victoria last week, and we were talking about approaching arthritis in sort of steps. You know, you do the nutraceuticals and then you do the massage and then you do whatever and then you add on, and then Librela should be only when all other pain management isn't working anymore. I think this is what this comment is about.
Okay.
Vaccinosis is not everybody call it that, but it's a term. All it implies is ill effects are following a vaccination, and there is absolutely no discussion or no doubt that vaccines can have side effects. The World Small Animal Veterinary Association write about this in details about ill effects from vaccines and how they can appear. I think the exact quote is days, weeks, months, or even years after the vaccine that directly caused them, which is why they're often not recognized. So vaccinosis is just a term that is sometimes used to describe ill effects following a vaccination. What was the other thing? The difficulty in assessing pain was the other part of the question, wasn't it?
Yeah. It was. I think because I said, didn't I, that does that mean that really for the pharmacovigilance, they need to be having more x-rays and more vet visits? So maybe, you know, that's part of it as well.
I think it's certainly, I'm not sure it's that is as difficult as it may sound, but I think it's a situation where regular visits are certainly in order and should take place with a physiotherapist or an osteopath or a local vet, because it's difficult to notice at home. Like, you don't see gradual changes, like you don't see your kids grow, you know, you don't notice. But if you have regular appointments with someone who examine the animal, watch them move, and who also just can direct your attention, you know, is she still doing this? How's she getting in and out the car? What's she doing about getting up on the sofa? Then I actually don't find it as difficult as it might sound. What would you say to that, Vicky?
I mean, I think that as holistic vets, we probably find it easier to monitor pain than some regular GP vets. And I think that's partly because of the style of our consults. So when you take a really detailed consult history and you go into loads of detail about the exact movements, what makes them better or worse, what times of day they're best or worst, you've got this huge load of information that you can then reference back to each time you have the next consult. And it's always so fascinating what people forget between consults. And, you know, sometimes you'll say, oh, you know, how's this symptom? And they'll be like, oh, that one's completely disappeared. I forgot that was even happening. Or, you know, you can say, and what about this? We talked about this last time. What's happening with that now? So you've got all this info, whereas some vet histories, it's, you know, lame left hind, stiffness in the morning. Well, you know, it can be like really quite basic. I think, you know, others give more info, but, you know, there's a huge range between those. Like, some of my consult notes look like I've written an entire essay about this dog or cat or whatever. So you've got a huge amount of info to reference back. So I think then it's easier because, as well, you're then alerting the owners for the things they should be looking out for. Because, you know, you say, is it better or worse in the hot or the cold? And suddenly they're then thinking, oh, maybe I should be looking to see if it's better or worse in the hot or the cold, and at times of day, and all of these like minutiae that they know you're going to ask about. So they suddenly start observing more. And I think that completely changes how they're interacting with their pet and what they're seeing or not seeing. And I think people miss that if they're going to see a regular vet, because it's a lot more kind of basic and superficial with the questioning. In some cases, obviously, if you see a pain specialist or anything like that, you're going to have more detailed info. But
I think that's a really good point. And asking people to do a diary also really helps, you know, notice changes. And like you said, a conventional vet is often straight on the table, and then you're examining the range of motion, etc., on an animal that's quite tense and worried, and it can be difficult. So it's a completely different way of conducting a consultation.
That's where I also think, and I often ask owners to take videos of their pet moving at home, in different gaits or out on walks on different surfaces. Not just if I'm like remote consulting, but just like in the consult room, because where I have to watch the dog move is in my practice, which isn't very big, or on the pavement outside. So it's literally like a straight line on tarmac. So it's not, you know, hugely accurate for seeing a huge different range of stuff. It's good for like, this is how it is today now. This will be how it is our next consult. So it's like the same each time, but, you know, it's very different to otherwise. So that can be a useful thing if you do have lameness or you're worried about your dog's movement. Take some videos and take them in and show them to your vet at the appointment, so that they can see what you're actually talking to them about, rather than just examine the dog that day, because the dog could be having a great day or they could be having a rubbish day, and that can make it look much better or worse than it might actually be.
Dogs compensate so much as well, and they hide so much. So many people with all sorts of breeds say that to me, that their dog really sort of hides what's going on. And I think sometimes it can be just a shift in behavior, or they won't settle. People say, oh, they don't settle as easily. And I'm convinced that's connected with like a pain kind of thing as well. Not with every dog, but if you've got that type of dog, which obviously presumably you have, otherwise you wouldn't be asking this question. But yeah, so it's, and also with FUSA, when she's getting to the end of her sort of 2 weeks of, because she's older now, so she has this vet physio appointment every 2 weeks. So towards the end of that, she's not so tolerant of people in her space. Now, I don't mean in an aggressive view, but she will literally just move as if that much space, she's fine. You can sit, she doesn't think she's in the way. But if you sit there, she's in the way, even though she's not in the way, because there's a heck of a lot of space between you. But it's just this perception for her. Her proprioceptive awareness is so much stronger, and she's like, whoa, I need to move out the way. And actually it isn't that at all. But she feels like that because she's obviously coming to the end of that 2-week period, and she's needing to feel that bit more flowy again, and less in pain perhaps.
I think people-pleasing dogs can be really tricky to localize pain on.
Oh,
My older bitch particularly, like I just, she can be lame, and I can test all her joints, I can feel everything. She gives you nothing. She just stands there. She's like, "Yep, look at me, I'm a good girl." And you're like, "Oh, that's great, thanks, Meg." But like, could you actually react in some way? And occasionally someone else can get a reaction from her. But even then, the McTimoney chiropractor who comes, she often can't localize it either. At hydrotherapy, they'll often feel and they can't localize it either, because she's just like, "Yep, I'm just good, I'll just stand here." And it's actually like really unhelpful. I just want her to have some negative reaction, even if it was like growling or snapping at me. At least I know what's happening.
No.
I did want to mention if people do want to monitor their pets at home as well, there are some helpful tools out there that can help you kind of do like a day-to-day assessment. For dogs, there are a lot of different like pain scores and stuff like that. You can use like a little checklist that you can like see every few days, and then you can see what's the score today. Is it worse today than it was last week? Is it going gradually worse, or is it like one day is worse than the other? I did recently found one for cats actually, because cats are terrible. They hide everything, and they're really hard to tell. I mean, unless it's like really extreme. There's an app called Feline Grimace Scale that you can download, that you can just click on, what directions are the hairs, how are they sitting, what's the ears like, all these like small things that you don't even think about. So it's actually a very nice app to be able to score them and kind of see where their pain level is at that day. So yeah, I did want to add that because I think it's a very helpful app also for even like in hospital monitoring their health levels when we're looking at how much pain meds to give and stuff like that is very helpful to be more subjective about it. Objective. That's it.
Just generally speaking, keeping track, monitoring, taking notes, taking pictures is such a valuable tool. And I'm always asking people to do that. I always think that there would be a great after dinner talk or something about that, because some people come in with, you want to know what's your job, because they come in with pie charts and colored graphs and, I did the diary and then I converted it into this, and you're thinking, wow. And then other people kind of go, but I wrote all these post-it notes, but I left them at home. And there's lots of different ways that you can monitor and write a diary. But it is very, very useful when you're monitoring pain or any other chronic condition, and full of helpful information. And just the process of recording will very often make people more observant. And I think that's how you do it really when you monitor someone who can't speak and can't tell you.
Okay, do we have any other questions, Tina, that we missed last week?
There was a message from Lana, because we listened to us talk about titer testing in one of the earlier recordings we did, and went to her vet and wanted a titer test, and the vet said, no, they don't work, so we don't do that. So she wrote back and said, well, what can I, what should I do? And
what do they mean they don't work, Lisa?
Well, exactly. I mean, yes.
You can't see the antibodies? I mean,
I literally see this
traveling.
I see this all the time, Caroline. So I've had so many histories this year where I've looked through and they've had a titer test done. And even these are like lab titer tests where they've sent them off to the lab for like £100+ or whatever. And it's come back, and the lab clinical pathologists have written adequate antibody levels, but it's been like just over what's adequate, and the vet's gone, oh, it's a bit low, so we're going to do the vaccine anyway. And I just think, like, why are you even bothering? Why bother sending it off when the pathologist says you're fine, you don't need to vaccinate, and you're just going to vaccinate anyway? It baffles me.
Yeah, yeah. Well, this is the thing. I mean, I know, Lise, you've said before that it hardly ever comes back, that the antibodies are low, but I have seen that it comes back.
Oh no, they come back in a certain group. They come back in the dogs that only have. It generally comes back negative in dogs that had the puppy vax and nothing else, and they can be up to a 1.5 years old. But if you finish the puppy jabs too young, they will have never been immunized, and that group is I mean, some studies show about 1 in 4 of those dogs as being negative when you do a titer test. But
I think the thing is, it's getting it done, but then unless you're having it done with somebody like Vicky at one of her teaser clinics, you've got to take those results and go and find a second opinion from a natural or holistic vet, I think.
But the idea that it doesn't work or that it isn't reliable is just ludicrous, because it's not a debate that's ongoing. I mean, a vet who says that is really saying, I haven't read up on this topic, but that's not going to stop me voicing an opinion. And a person who says that, in my eyes, I'm sorry, but you just lose all credibility. I mean, what else are you going to speak up on based on nothing but a hunch? I mean, you really need to go back and check your sources. And the WSAVA very clearly say not only that it's fully validated. I wish I could remember, maybe I can. I don't want to dig it, I could almost dig it out now, but they say something like, if you want to achieve a gold standard, you can only do it if you do a titer test rather than vaccinate blindly. And they have a Q&A section at the back of each of the WSAVA guidelines, and one of them is where the question is, isn't it simpler just to vaccinate, because if the titer test is negative, we have to vaccinate anyway? And they're saying you could say that, and we recognize that the titer test is relatively expensive, but it's really not good practice to vaccinate blindly. We need to know what we're doing. We need to test before we perform any kind of procedure, and a vaccine is a procedure. I mean, this is the world's leading experts talking. There's nothing holistic, there's nothing alternative, there's no opinion involved in this, really. This is the greatest minds in veterinary immunology. So if some vet somewhere decides it's not reliable, all I can really say is, why are they your vet? Because I wouldn't trust what they say. And I don't know. I normally try to be more polite than this, but I'm failing when someone says that, because it's just so blatantly incorrect that I wouldn't trust what else they might say.
Yeah,
I mean, the thing that most vets seem to say as their reason for it is that they say, oh, it's just a snapshot in time, and those titer levels can change really quickly. And you think, like, if you're testing for a disease and you're looking at the titer levels, you have to leave a certain amount of time between tests to see whether the titer level has risen. Because, like, it's not like pouring water in or out of a glass. It doesn't happen instantaneously. The immune system has to react to it. So it's not just going to immediately change, and they fade much more slowly than they can increase if you encounter disease. So to me, that just seems such a bogus argument. It just indicates a lack of immunological thought process.
And it certainly demonstrates that you haven't read the studies and you haven't read the WSAVA guidelines, because the studies are there showing lifelong immunity, and the WSAVA guidelines clearly describe that we're not expecting them to drop. Then they're also very clearly saying we're not recommending that you test every 3 years because we think they drop. It's just to kind of accommodate the culture that we have, where people expect to see certificates on a, every 3 years has historically been how often we vaccinate. So let's just titer test every 3 years instead. It's not because anyone thinks that it's going to drop. The studies have been done to show that they last. I think the studies have been done based on blood tests for up to 9 years after the last vaccine, and no, it's the other way around. I think they've tried to expose them to disease up to 9 years after the last vaccine, and they've done the blood test up to 14 years after the last vaccine. I mean, the studies are in, and the test is completely validated. So the only point to make really is that it's not a situation where, well, one vet thinks this, the other vet thinks that. Who should I believe? The experts have absolutely spoken, and if your vet hasn't read the papers, then maybe don't trust them. That's really all I would say.
Our comments have gone crazy. We'll get there. Because I can't see you guys. I'm actually quite excited when you're watching all the comments. So it's cool. Actually, last week, this is what we could have been doing for you. Didn't even know that you could. But Beth has said, don't dogs have to have some sort of exposure for the antibodies to be active? So if they're negative, could it just mean no exposure? And this is what I always say, because Catherine O'Driscoll taught me this way, that you can have this underlying immunity, and if you haven't come across the virus or whatever, or it might be a bacteria, but normally the virus, then you wouldn't produce the antibodies. So actually, the titer is only showing what you've produced, because either it's still in there from when you had the vaccine, or you've come across it lately for whatever reason, shedding or getting it off a different dog or whatever. So, Beth, I personally think, how I was always taught by Catherine, who I do see as the goddess of vaccinosis, that yes, I would say that is the case. So then
I would say it's a myth, but it's a myth that's based on some truth, as myths often are. I mean, Catherine O'Driscoll was generally into this topic at a time where we didn't have the titer test, and certainly not the experience in using it that we have today. And it's absolutely true that we can't measure cell-based immunity. We can only measure antibody production. But it just so happens that I don't know how it works exactly. I'm guessing the immune system kind of wants to be priming itself constantly. Certainly when you do a titer test, it's not, they don't come and go. Once they're there, they're there. And again, the studies have been made to demonstrate this. The studies have been done decades ago. So the theory behind it is true, but in practical terms, not really. I mean, certainly if you have a negative titer test, I would absolutely vaccinate. I mean, anything else I would consider dangerous. But they just don't tend to go negative once they've been positive.
The thing is, the antibodies are proteins, so they need to be broken down by the body. So if you have a really healthy dog that's capable of breaking down those antibody proteins quite quickly, when I say quite quickly, it might still be 3 years, and to remove those are needed. But if they're not perhaps able to do that, then they could perhaps stay in the system for longer.
But they're constantly being produced. It's the way the system kind of reminds itself, keep a low level going so that we're ready if something happens. They're certainly being, I mean, I'm not an immunologist, so I don't want to be, but I mean, when we do the titer tests and when you read the studies based on, thousands of titer tests being done, once they've been positive, once the first one has been made that's been positive, they tend to stay positive. And there are certainly experts like Richard Ford from America who says it's silly to ever do more than one. Because if you have one positive and then they later go negative, it's going to be a false negative, surely. The first one is the important one, because that the dog at the time when you do the first one needs to be old enough for maternal antibodies to be ruled out. But once you have a dog that's 5-6 months old or older and has a positive titer test, then you could just say, well, that's that dog vaccinated for life, and probably be quite safe. It's just as Michael Day, who was the head of the WSAVA vaccine guideline expert group, he agreed with this, but he just said for an interim period, we'll repeat them every 3 years just to demonstrate to everybody that they don't disappear.
So if with a dog, and we'll take cats into this framework as well, what you're essentially saying is that the immune system needs to reprime itself in some way. And we're titer testing to check that it's primed itself in case it's going to have exposure to these viruses. I think that's what you're saying. Why is it that our immune systems don't have to necessarily do that then? Because we are given our vaccines at birth, if you like. Now, there are a few that are based on the 7-year. So the way Catherine used to teach this is that if the immune system needed to be primed, we, as to use the word primary, we would be the primary people, if you like, the primary beings on the planet that were encouraged to protect ourselves by priming all the time. Now, I know that that's happening for mutatable diseases at the moment, but take them out the picture. We're talking about non-mutatable diseases with the DHPPI predominantly, obviously not with the influenza one. But so do you see what I mean, though? Why
No,
say?
I don't think I understand the question, but maybe we mean something else by the word prime, because I'm not, I think humans are exactly the same. I mean, you can do a titer test too. You know, titer testing is commonly used, like kids, for instance, if you don't want to, titer tests are done in human. By priming, I just mean a process that happens in the immune system by itself, just to remind itself of what it's protected against. I'm not suggesting any outside factors. I'm not talking about boosters or exposure or anything like that. I'm just using a term about the process that helps the immune system remember something that it learned years ago, which it clearly does. But I'm not an immunologist, so I wouldn't want to second guess the exact process by which it does that. But all I'm saying is, if a 4-month-old puppy has the core vaccines at that point, has a positive titer test afterwards to show that the vaccine worked, the puppy's immune system worked, the two came together beautifully, there is now protection. That protection, according to the WSAVA, in at least 98% of those puppies will be lifelong with no boosters, nothing else needing to be done at all. So somehow the system primes itself, because at any point in that dog's life we can do a blood test and we can see those antibodies regardless of exposure. So I don't think exposure is an important factor in this. No.
Well, maybe it's not that it's priming; it's just that it hasn't broken down those proteins.
Sure. I mean, I used that word wrongly. I'm just saying the immune system remembers. The antibodies are there even if there's been no exposure, and they'll be there 10 years later, even though the dog has never come across. I mean, some of those diseases, hepatitis particularly, it probably never meets, but there will still be measurable antibodies. Those studies have been done. So it remembers.
Looking at the titer levels just on the dogs, like I do quite a lot of titer testing, and some of them I've done for, you know, multiple tests in a row over a longer period of time, and it can be really interesting to see how the levels can change. And you know, the one that often goes up between tests is the parvo, because that's something that they are encountering, and so they're effectively getting a boost to the antibody production because they're encountering it. And the ones that, if any, tend to fade out in the older dogs are the hepatitis and the distemper, because we just don't really see those diseases in this country anymore, at least not at any kind of high level in any way, shape or form. So yeah, I mean, I do see them fade out in older dogs sometimes, but if we've done a previous positive, then as long as the pet doesn't require some sort of certification for something like a kennels, then we tend to just leave those animals, because it's an older dog anyway. And if you're only supposed to vaccinate healthy dogs, then most older dogs have some kind of thing going on that takes them out of that healthy equation. And so there's multiple reasons for us not to opt to do that anymore.
And it's also an important point, if we're talking titer testing, is that the level doesn't actually matter. You know, a high level is not better than a low level. It's a positive negative situation.
No, I'm totally with that, and I think I think on a practical level, the Guardian maybe understands that. They just want to know if they should do it again. And I've always been more what Vicky kind of said, where, you know, you wouldn't necessarily do it again, especially if they're a bit older, and, you know, they've always shown the titer's been fine before. Whereas I don't know whether I got the wrong impression, but it was almost like you were like, Lise was like, no, well, I would do it then, you know, if there was no antibodies, I would do it, sort of thing. And I don't know whether
but by do it, you mean vaccinate?
Sorry.
No, sure. If there was a negative titer test, I would absolutely vaccinate.
But I don't know that Vicky would. I don't know.
An older dog, I wouldn't know, and I don't think Lise would either, because actually, if you go back to, I think Lise is misunderstanding your question, because if you go back to her original analogy about the cookies and the recipe and the bacon,
I love that.
you know,
I love that. In the old one,
if they've had a positive titer before and it fades out, they still have that recipe. They just haven't been baking their cookies.
Sure. And that's the more important point, is that I wouldn't necessarily insist on continuing testing. I mean, the important test is the first one. And after that, I'm not overly concerned whether someone continues to do the titer testing. The WSAVA says, why don't we for a while do it every 3 years, just because it gives people the certificates that they need. But I don't think that's crucial. But I also think it becomes a bit silly, though, if you want to test and then not respond to the test. But then again, it's not my experience that it's often a problem, because once they've been positive, they tend to stay positive.
Mm-hmm.
But the question was, what do we do about a vet that says that they don't work? And I would say just disregard everything that person says after that.
I think the simple thing is I would just find a different vet for your teacher.
Yes.
And if you trust them for other things, then that's fine. This might just be their mental block. Some vets have a real mental block against anything that they consider holistic, and teeter testing has come out of holistic vets promoting it, and therefore owners asking their regular vets about it. And some vets, they just like, it doesn't matter what it's related to, doesn't matter how amazingly your dog has done on the medication, the vet's just going to go, bloop, nope, no interest. So if that happens, then you just don't talk about those things with your vet if you like them otherwise, or you find a vet that's more open to discussing all of the other things.
But it's not a but you're absolutely right, of course. But yet the WSAVA has said for more than 15 years, this is the gold standard of practice. So if your vet has that sort of a bias, maybe they're not the most reliable source of information. I sometimes say that you can use this, you can be grateful for this, because it can be a test of, it's hard to assess your vet. You know, do they keep up with stuff? Do they follow their field? And if they don't know that titer testing has been highly recommended for 15 years, then what else don't they know?
Yeah.
That would be my take on it.
Yeah, absolutely. Yeah.
Yeah, and for those who are listening and they're new to titering and they don't know which vaccines and so on that you can titer, so now we're mainly talking about dogs, and we're talking about the DHP core vaccine. Now, most of the other bacterial vaccines you can't really titer for, so you still have to decide every year if that's something your pet needs or not. In humans, you can titer for rabies. Unfortunately, in animals, the rules are very strict. So if you need a rabies shot to travel or in your country, then that's nothing, unfortunately, you can test for. Even though most rabies vaccines can last for very long, I titer tested myself. I think I'm over 5 years in, 7 years, and still positive titers. When it comes to cats, you have the Calicia herpes, but no, the third one. Brain block.
Panleukopenia, you can
Panleukopenia. Thank you. So yeah, that one you can titer test for. So, but yeah.
When Barbara has asked a question, and it says that her golden retriever was teated at 15 months and at 4 years, should she do it again, or should she do this for him again? Well, it depends what the results are. That's what we've just been kind of having that debate about, you know, like what were the results before?
It depends why you're testing in the first place. Testing for your peace of mind. If so, then you might find that your peace of mind is now reassured and you don't need to do anymore. If you're testing because they go to a class or a daycare or a kennels or something where they need some kind of certification, then you're going to have to carry on testing. So it really depends on what you want. And I always say to people, you know, it's up to you. If you would like, some people test every year because that's what their kennels have said that they need to do, even though it doesn't match with the science. And you know, others do their own kind of protocols. They're like, oh, you know, it's been like 6 years since I had one, but I just wanted to make sure that everything was still okay. You know, it's once you've had that positive test, like Lee says, it's about what you need for whatever your lifestyle and your dog's lifestyle is.
Yeah, I agree. Yeah, absolutely.
Actually, we do have one question here in the chat that maybe Vicky, who's English, can answer, because they're confused about the pronunciation of teeter. Someone says titer, someone says teeter, titerations. What's your comment on this?
So I get asked this all the time, and to be honest, I often use them both interchangeably. And if someone says titer to me, then I will say titer in reply, and if they say teeter, then I will say teeter, because you know that's just the way it goes.
Potato.
Same thing. Yeah.
And if you're British, it's TITRE. If you're American, it's TITER. Just to add to the.
I think I'd probably say teeter more, because if I'm doing a teeter testing clinic, my partner always goes, "Oh, are you going to get your teats out?"
I always remembered it as teetering on the level of, like, that's what I kind of remembered it as. I don't know why, but
then there's like titration of stuff and like chemical experiments. So like,
Oh yeah, I think it doesn't matter as long as
Yeah, I
I mean,
really
but that's where the word comes from, because, well, titrating, whatever you want to say, it means a succession of dilutions. We know where you dilute something more and more and more and more to establish the level at which you can no longer identify it. And that's why we use the word, because a titer means a level of something, a level of a dilution of something where it's still, where you can still see that it's there. So it's a level of antibodies. So you keep diluting until you find the level where they're not there anymore. And then the lowest level where they were, that's the titer, or that's the titer. That's the level. It means the level,
yeah.
in that chemical process.
Sorry,
that I
many
will try to
pronunciations.
pronounce.
Yeah, many pronunciations, same thing.
Yeah.
I think we're on time.
We probably are after
We are.
that.
Fantastic. Yes. I'm going to say, what do you call it? Disconnect us and say thank you very much to Vicky and everyone who's been listening.
Yes, thank you for your questions, and keep